Hi, my name is Jennifer Brown. I'm a nurse practitioner student at Regis College, and I will be videoing a head, ear, eye, nose, and throat assessment for NU 650. My patient today is Christy, and do you consent to being recorded?
Yes.
Okay. First, I'm going to start by examining your head and looking for any kind of deformities or masses. You have even hair distribution. Nothing hurts or feels different today.
No.
Occipital, ear, temporal pulses. And I'm going to have you open your mouth and go ahead and close. And check the TMJ. Good. Excellent. Next, I'm going to move on to taking a look at your eyes, looking for any kind of discharge or crusting of the eyebrows or eyelashes. Everything is symmetrical. I'm just going to take a look at your lids and your sclera. Everything's clear, nice and pink. There's no yellow to the sclera at all. Get my light source. And just check pupillary response. Good. Excellent. So when the right light is shown, the left pupil constricts. And it's the same on both sides. The pupils are equal, round, and reactive to light. Change my scope. And it is set to 0. I'm going to check for the red view of the pupil. Let's take a look. And then I would switch eyes and do the same. Excellent. I'm going to check visual acuity. I'm going to have you use this piece of paper and cover one eye. This eye chart would be 20 feet away to be able to assess for 20/20 vision. And you would go ahead and read the smallest line that you can.
DHJBS.
Excellent. And then you would change eyes, ask the patient to cover their other eye, and do the same. Moving on, we're going to take a look at your ears. So here, you're just going to feel me touch. I'm looking for any kind of deformities and moving the pinna to assess for any kind of discomfort in the ear canal. Go ahead and gently insert while pulling the ear up and back. And visualize the tympanic membrane. See that it's nice and clear. There's no fluid or excessive earwax there. And you would check on the other ear as well. Next, we're going to check your hearing. We're going to do 2 different hearing tests. One is called the Weber test. I'm going to strike the fork and place it on the crown of your head, and you can let me know which ear you can hear it in. Right, left, or both? Both. Then we're going to check your air conduction versus bone conduction with the Rhine test. Here, tell me when you can stop hearing that. And then here, can you still hear that? Next, we're going to move on to your mouth. Take a look. Go ahead and open your mouth for me and say, ah. I'm checking the back of the soft palate, the uvula, the tonsils. I don't see any white spots or redness there. Go ahead and lift your tongue. Taking a look at for salivary glands. I'm gonna feel inside of your cheek, feeling for any masses, and then the lower palate as well. Looks good. Next, I'm going to take a look inside of your nose. So I'm going to have you just tilt your chin up. You're just going to feel me have a little pressure there. Checking for the turbinates, any kind of deviated septum at all. Everything has a nice light pink color, no irritation or evidence of bleeding. I'd like for you to close your eyes. And I'm going to block one nostril. And I want you to take a deep breath and tell me what you smell. Cinnamon. Next, we're going to move on to checking all of your lymph nodes and taking a look at the outside aspects of your throat. We'll start with your lymph nodes here. We'll in front of your ears, behind your ear, occipital, tonsilary, submandibular. Follow the chain down. One's here. Your supraclavicular and deep clavicular on both sides, following the clavicle line. And then I'm going to have you turn your chin. These are the deep ones, which you may or may not be able to palpate here. Check for tracheal deviation. Just move slightly side to side. And then to palpate the thyroid, go ahead and swallow for me. You should be able to feel the thyroid just slide up by your fingers and then back down. If it's more comfortable, you can do a posterior thyroid palpation here and just have the patient swallow, and it should feel normal.